Okay, hello everyone. Today I'm going to talk about the algorithm for the approach to red eyes. Okay, so red eyes are very common in ophthalmology. It is basically our bread and butter. Okay, so it is our job to be able to diagnose it properly. Okay. And this is basically a guide for, especially for medical students and also for junior doctors. All right. So, okay, first, red eyes is divided into infective and non-infective causes. Okay. As for the infective causes, we divide it into red eyes with discharge or red eyes without discharge. Okay. So red eyes with discharge, and we go into the one which can threaten the vision. Okay, first most common is infective keratitis. Okay, infective keratitis is basically it can be like bacterial keratitis, like corneal ulceration. It can be due to because of contact lens. The most common is contact lens. Can be due to ocular trauma. Okay, there are many causes, but mainly it is because of infection. Okay, next, red eyes with discharge, vision threatening. Number 2 is endophthalmitis. Okay, so endophthalmitis is basically the infection in the all ocular tissue. Okay, the ocular tissue, whereby it can be due to probably secondary to cataract surgery. The one is exogenous endophthalmitis, and probably secondary to trauma. However, it can also be because of endogenous endophthalmitis. All right. Basically, the eye is red, vision is down, patient is in pain, and also there's a bit of discharge, probably watery, probably a bit of discharge like conjunctivitis. Okay, but usually it has hypopion and very bad vision. Okay, next, another cause of red eyes which is threatening the vision is orbital cellulitis. Okay, this is a bit advanced because the infection probably has gone above the septum, after the septum, so patient will have low vision, patient will have restrictive ocular movement, and also involvement of the optic nerve, okay, whereby the vision is down. Okay, so this is vision threatening. It is one of the urgent red eyes. All right, and next is vision threatening also, which is the gonococcal conjunctivitis. It is not common. It is infective in nature. Actually, it is more of a sexually transmitted disease. Alright, so it is atypical. The discharge is very bad, and there is a positive history of sexual encounter. We rarely see this, but once we got the culture as positive for gonococcal, it is actually an urgent in its urgent treatment. Okay, so how about red eyes, infective in nature, with discharge, but which is non-vision threatening? Okay, this is our bread and butter, conjunctivitis. Okay, conjunctivitis can be due to viral. Commonly, is due to viral. And if in viral conjunctivitis, usually the discharge is watery. Okay, and how about bacterial? Okay, usually bacterial, the discharge is more of purulent. Okay, however, most of the time you cannot really distinguish, so always just presume it is. You can also cover, even though it's viral, you can also cover the conjunctivitis with some antibiotics. Okay, all right. And however, in chlamydial conjunctivitis, it is a bit unusual because the red eyes can go on into months and months and months. Okay, all right, and it is uncommon. It is also a sexual transmitted disease. All right, okay. Okay, now we go on to red eyes, which is infective in nature with discharge but non-vision threatening. Okay, for the lid. All right, so patient could be having blepharitis. Okay, inflammation of the lid margin, external hordeolum. Also, the lid margin is red, and also chalazion. All right, those are the non-vision threatening causes. Okay, so how about red eyes, which is infective in nature without discharge, however it is vision threatening? So two most common causes are anterior uveitis and also anterior scleritis. Okay, so anterior uveitis and anterior scleritis can be due to infective and also non-infective in nature, so it is placed in both of the wings. All right. Okay, now we go on to the red eyes, which is non-infective in nature. But it is also painless. Okay, painless with discharge. Okay, the most common is actually the one which is non-vision threatening, which is allergic conjunctivitis. Usually the discharge is watery or mucoid. Okay, and the thing about allergic conjunctivitis, the history is usually very long. Okay, however, vision usually in the beginning, vision should be normal. Okay, unless it is like very chronic, and actually patient do have some patient can also have some corneal ulceration basically. Okay, all right, in long history of allergic conjunctivitis. All right, okay, how about with discharge, vision threatening? Okay, one of the causes is cicatrizing conjunctivitis. This is actually due to severe allergic reaction, such as in Stevens-Johnson syndrome, toxic epidermal necrolysis. Okay, it is uncommon, but you will get called for all these things. Okay, if patient have severe skin allergy, the eye can also be involved because of the mucous membrane. Patient can go blind because of this. Okay, all right. So how about red eyes, which is painless, without discharge and non-vision threatening? Okay, top of the list is episcleritis. Okay, actually episcleritis patient may have some discomfort, but the pain is not that bad. Okay, and they usually have a patch of redness in the eye, commonly in young women. Okay, and next is subconjunctival hemorrhage. It is also very common. It can be spontaneous, it can be due to trauma, it can be due to excessive blood thinning drugs. Okay, and then next is pterygium, which is at the conjunctival level, and also pinguicula. Alright, pterygium is more common, whereby there's this triangular red patch in the eye near the outside the cornea. Okay, however, it can threaten the vision if the pterygium is very advanced. It can cover the cornea if it is bilateral pterygium, nasal and lateral. Okay, but it is not very common. Okay, all right. So how about red eyes, non-infective in nature, but it is painful and there's no discharge. Okay, and it is also vision threatening. Okay, top of the list is corneal abrasion. Okay, corneal abrasion is usually due to trauma. Okay, and corneal foreign body, perhaps due to welding or whatever. You go by the roadside and then there's this wood enter your eye, things like that. Okay, but as you know, corneal foreign body, if it's small, probably it's not vision threatening, but if it's big, it can cause severe problem. Okay, and next is acute angle closure glaucoma. Of course, it is very painful. The intraocular is very high, and it can also causes blindness. Acute anterior uveitis. Technically, it is eye pain, red eyes, in fact. Okay, and in the long run, it does cause vision threatening. Anterior scleritis, the eye is very red, the pain is very bad. Usually, it's deep throbbing pain, and hence, patient will tell you that they are unable to sleep at night, and also if you accidentally touch the eye, it is very tender. Okay, and the vision can be compromised. Okay, so basically the one with this triangle marking is basically the ones that is vision threatening. Okay, I hope this algorithm will help you. Maybe next time we can add up the treatments in the algorithm. All right. Okay, till next session, do tell me what else do you want me to teach you. All right. Okay, enjoy the slides. Okay, bye.